Hi everyone, this video is about trichotillomania or hair pulling and how to stop that behaviour or get someone to stop that behaviour. It's often brought on by stress. It's a coping mechanism as well, and often is a source of relief from that stress or the situation that the person's in. Can cause balding and thinness of hair in that area where the person pulls the hair from. So this is some strategies that we can use with someone to reduce that behaviour and stop them from pulling that hair. So firstly, the person you want to change the behaviour needs to be willing. So the person has to want to change this behaviour. Without that, this isn't going to work. So firstly, we need that from them. So from there, we'll conduct a assessment period. So a 7-day assessment period where we can get some information on the triggers of the behaviour, so what causes the hair pulling. So we'll start that with, we give the person a form to fill in. On that form they will have the date, the time, the feelings before, the feelings after the hair's pulled, the location, and this is filled in every time the person pulls a hair out within a whole 24-hour period. So they'll always have that on them, and during that time, whenever they do pull a hair out, they will record it down. And this is going to give us information on the triggers, which we can use later on in the behavioural changing therapy. We'll also be doing an interview with the person, so that's what you'll do. You'll sit down with them, and in that interview we're just trying to find out what some of the triggers are from them, so when they feel other times when it's going to happen, and also we're going to ask them things like how many times they've tried to stop in the past, what's worked for them in the past during that assessment period. We're also going to give them an envelope, so each time they pull the hair out, they're going to put that hair in the envelope. So they always have that envelope with them, as well as the form, and they put that in there, which we'll use later on during the behavioural change therapy. So once we do that, we conduct that for a 7-day period, and that will give us information on what we need to do to change the behaviour and help us in the behavioural changing therapy. So after that 7 days, we'll start the training. First thing you will do is, in a session with the person, is give them the envelope with all of the hairs in it, and that just shows them up front how many hairs they are pulling in that time period, and seeing that in front of you, it does have a large impact on them, and does make them more willing to change, and gives them more impetus to change as they see how much is actually in there. You'll also teach them an opposing strategy, so something that's not compatible with hair pulling. So we'll teach them fist clenching. So clenching your fist, can't pull your hair, and this will help them to stop that. So we teach them to do that for 10 seconds, or say if driving or something like that, they can squeeze the steering wheel, which is the same thing. You can't pull your hair while you're doing that. Now, from the information we got in the data collection in the first 7 days, we should be able to know the times when the person is more susceptible to be pulling the hair, what the triggers are, the situations, So we can make the person aware of the times when they're most susceptible to doing that. For example, when they're stressed. So each time they are stressed, make them consciously aware that they use their competing response. They use their competing response of the fist squeezing whenever they're stressed, or whenever they're driving the car, if that's what you found is a situation which triggers the hair pulling, or whether they're at work or sitting at the computer. As long as they're consciously aware that this could happen at these times, they can use their competing response, which is the fist squeezing, so they aren't pulling their hair. Also, we will be setting targets. So once we've taught them the fist squeezing, the competing response, we have showed them the envelope. We'll now set them targets, daily targets on hairs pulled. So in the beginning, say if they're during the 7-day period where we're gathering data on their hair pulling, if they pull 10 per day, then first day we may set a goal of 5 and drop them in increments down from there. So within a few days, up to 5 days, we'll have them down to 0 hairs pulled day as a goal. Once that's reached, we'll start setting longer goals. So 0 hairs pulled per 2-day period, and extend it from there. So from 2 days to 3 days, 4 days, and extending that out. So once those goals are met, we reinforce that good behaviour in meeting those goals. So every time they meet one of those goals, we offer praise. We can give rewards depending on what the person would be receptive to. That's up to you what you reward the person with. But as long as we're reinforcing with positivity the good behaviour, the person will then hopefully want to meet these goals and continue moving on. So eventually there's 0 hairs pulled, and it's no longer habitual. So these are the 3 things that you teach the person at the start, and then we set the goals moving forward. And we'll do the behavioural changing therapy for a month. So we'll collect data on it for a month, and so we can see the progress that we're making. So the person will have that sheet on them for 7 days, plus the month of behavioural changing therapy throughout that time. So hopefully by the end of that, after that period where they've met their goals, we've taught them their behaviours, the new behaviours, and they've reduced it to 0, hopefully then we have cancelled out the behaviour, the hair pulling, and we've then changed that to non-hair pulling, and it's no longer habitual, and the hair can start growing back, and they'll see a lot of positive changes there. There is the risk of relapse. They need to be made aware after the month-long period that there is the chance of relapse. What we can do is we can set a follow-up a month later, 2 months later, and make them regular, so we can see the person, and if they have relapsed, we can put some things in place to change it back. So we can make sure we're teaching the opposing strategy as well, and set some new goals, and at least we know we can get on top of that. And hopefully if it does relapse, we can change it back, and over time, it may relapse a few times, but if we keep this up over time, the behaviour will change and they will stop pulling the hair out over the longer term. Also with the goal setting, the If they don't meet the goal, we don't reinforce it, so we don't offer the reward or praise. We just make them aware that they're very capable of meeting the next goal, and then once the next goal is met, then we offer the praise and reinforce that good behaviour. So we're not reinforcing the incorrect behaviour. So hopefully you too can use these strategies. If anyone close to you or comes to you for help for hair pulling from the scalp, then hopefully you can help that person and successfully change that behaviour as well. Thank you.